Inner Voice, a heartfelt chat with Dr. Foojan.
Hello, everyone. Welcome to the Inner Voice podcast. It is so great to be with you. I'm Dr. Foojan Zeine. I'm a psychotherapist and the author and the originator of the awareness integration theory. Our conversation here is about what matters most in our life, our minds, our thoughts, feelings, actions, relationships, and our fulfillment in this beautiful journey of life. For all the psychotherapists out there, mental health practitioners, and life coaches, the Essentials of Awareness Integration Theory course is coming up June 24th to 26th. Early bird special is June 10th. Sign up. The space is limited. Love to share with you. So contact me at Awareness Integration Institute at gmail.com, Foojan Zeine at gmail.com. Go to awarenessintegration.com. Any of those, just call me. Let me know. Today, I'm excited to speak to Dr. Saloni Sharma. She is a double board certified in pain management and rehabilitation medicine. She's the medical director and founder of Orthopedic Integrative Health Center and Rothman Orthopedics, and has treated thousands of patients. She's also co-chair of pain management and spine rehabilitation for the American Academy of Physical Medicine and Rehabilitation. She's a popular speaker at Google and an award-winning clinical assistant professor at Thomas Jefferson University Hospital. You can find her at salonisharmamd.com. We will be talking about her latest book, Pain Solution: 5 Steps, ready? 5 steps to relieve and prevent back pain, muscle pain, and joint pain without medication. Yes, without medication. She has an amazing book that takes you step by step in doing that, and we're going to chat about it. Subscribe to this podcast, my YouTube channel, and connect with me through my website, foojanzeine.com, or any of the social medias. I love to hear from you. So here it is. Well, here we are with Dr. Saloni Sharma, and it is so nice to have you.
Thank you. Thank you for having me here. I really appreciate it.
So you have authored the book, The Pain Solution, to relieve and prevent back pain, muscle pain, and joint pain without medication. Now, I'm positive everybody that is hearing us and who's going through pain turns around and says, what? What do you mean without medication? I need my medication. And I know myself, when I've gone through pain, that the first thing is like, give me something to take this medication away. But I also know that pain medications can be very addictive. And obviously, we have definitely a problem in, let's just say it, around the world about this. And I've also worked with addiction for about 30 years. So I also know what happens. And then a lot of times with the type of opiates, we also have character changes, personality changes after many, many years of using that. So when I saw your book, I'm like, yes, that's awesome, because we really, really need to look at that venue. So share with me, based on your experience of all of these years, what got you first to write the book, and then share with us your experience of how you got from, your experience in not going toward medication and having the alternatives.
Sure. Thank you for that great introduction and discussion. It is a huge problem, as you said, and it's devastating, individuals and families and communities, just worsening, unfortunately, over the years. In terms of the book, it was really something that was missing. So, there's a lot of people who are told, don't take pain pills, or they don't want to take pain pills, but they're really not given alternatives or other ideas. And I completely hear you. When you have acute pain, you may need a medication, and that's, human nature, and that's normal. So I'm not saying never take a pill, but I'm saying if you have ongoing pain, or if you're trying to prevent severe ongoing pain, there's lifestyle changes or things you can do in your daily life that make a difference. And the reason I wrote the book is because physicians like myself, we're usually with a patient for about 15 minutes on average, oftentimes less, unfortunately, for many unfortunate factors. And so it's really what people do for the other 23 hours plus of their life that matters. And that's what affects their pain. And it really boils down to inflammation. So even, with mindset and mindfulness, that all goes back to inflammation too. So we really want to reduce inflammation, which reduces pain. I like to use an analogy of someone with arthritis of their knee. The arthritis of the knee is there, right? You get that diagnosis, it's on x-ray, people can see it, you have arthritis, but it's not always swollen, right? It only swells up sometimes. And the difference is inflammation. So same thing in someone's back or someone's joints or someone's muscle pain is when they're inflamed, it's painful. So if we can reduce inflammation with simple things, and that's really what I really try to emphasize in this book is the why it matters, and the how, and to make the steps really easy. And I even coined a term called micro boosts, which are little steps that add up to big relief. So tiny little tweaks we can do in our day to really help calm inflammation and reduce pain in the long term. And in fact, build pain resiliency. So try to prevent some future severe pain too.
A couple of things that I'm hearing from you. One is a lifestyle change. So it could also be that if people have the ability, that they're not in pain yet, and they know that they're aging, or that they are in type of a lifestyle that is a little bit risky. Maybe they're in sports, or they do things that their job requires them to move things in a particular way, which could have a back injury or a backache. I work with a lot of mothers, which with their first child and second child, they really, because they have to keep picking up the child from the bus, and they don't do it well, as they're not really connected to their body, so their movement just creates a lot of pain for them. And so the first concept is, if you could be proactive and create a lifestyle change for yourself where you could really prevent, or even if it's there, to manage it well. So one I heard was food. So for food to calm down the inflammation, exercise, sleep. These are some of the concepts that I had kind of read in your book, that these are important in order to bring down the inflammation. Did I get that accurate?
Yeah, that's right. So those are the 3 of the 5 steps. The other 2 steps are working on stress reduction, which I know you're an expert on, as well as relationships with yourself and with others. So really mindset comes into play, as well as coping skills.
Yes. I remember at one point I had moved in a very, very weird way. And I was at somebody's house, and I sat on the couch in peculiar way. Something got pulled. I could not walk. So they had to carry me home. And then the next day, I could not get up. Literally, I could not get up. I had lost all of my muscle capability because the pain was so excruciating. Saloni, I wanted to die. I remember that day. I said, this is it. I cannot handle this. I just don't want to live. And this is something that I consistently hear from my clients, that the pain brings the utmost level of depression, utter powerlessness. And I remember doing the MRI, doing all of that, and it was like, nothing. You just, pulled really bad. And they told me to go to Pilates and really, to work on myself and really exercise, and to be able to do that. But this concept of I can't do anything, I don't want to do anything, and just give me something that I can get out of it as soon as possible, which brings us to pain medications. Mm-hmm. And I know from your work that you've had to deal with that. How do you support your patients and clients, and not going from, I just want to die right now, give me something, to getting them into the lifestyle changes and things that they got to do?
Yeah, and I'm sorry you went through that. Unfortunately, it's all too common. As you may know, more than 85% of Americans will have back pain at some point in their lives. So either yourself or a family member or friend will suffer with back pain alone. That's not even talking about muscle and joint pain, as well as neck pain. So I think when you're in that acute painful situation, I don't think there's anything wrong with the medication. I just don't think it should be an opioid medication. So I think that's a distinction. If something's acutely inflamed or injured, then yes, sometimes you might need, an anti-inflammatory or a muscle relaxer or something along those lines temporarily. And that's really the key. It's temporary, right? So you throw your back out, for example, you shouldn't still be on the muscle relaxers 2 months later. There's other things that should be going on, maybe for a week, maybe 3 or 4 weeks, but you should start to get some physical therapy, like they suggested to you with the Pilates, some core work. You should start to look at other medications. You should start to look at your ergonomics. You should start to look at stress. I mean, maybe that was a stressful time in your life, and your body internalized that. And we all carry stress, for example, in our traps, we just sort of hunch up. And if you're prone to a neck issue or a spine issue, and then you tense up, that's just going to amplify it. So it's really looking at all the other aspects. Maybe you weren't sleeping well for the days leading up to that. And it's not a blame game, because I'm definitely not trying to blame anyone. This is our society. We're always going, we're always running, we're never resting. I even have a concept in the book called an adult timeout. So, it's really just taking 10 minutes a day and really scheduled into your day to do something you enjoy. And it doesn't have to be, sitting and doing formal mindfulness or meditation and with a mantra and chanting and all this. And there's a lot of data behind that. So I think that's wonderful if that's something that people are engaged in. But if that's not for you, it can just be an activity you enjoy and makes you mindful and present. So you're not thinking about what you have to do later or what you didn't get done. You're kind of in what they call the flow state, right? You're in the zone. It could be cooking, it could be painting, it could be woodwork, it could be writing, it could be singing, it could be many things. It's something you enjoy and that makes you present. So that's sort of the concept is, yes, you may need a medication in the beginning, especially when you're in that acute pain. But I think it also is helpful to have someone say, let's give you a medication that's not a narcotic and let's help you out of this. And someone to remind you, this isn't forever, right? You have that feeling of, I want to die, because your mind catastrophizes. And I don't want to speak your words because you're much more knowledgeable about this than I am, but your mind catastrophizes about, oh my goodness, worst case scenario, I'm going to be like this my whole life. And no one wants to be like that their whole life. But it's really just a moment in time. And so getting some perspective and having someone who helps you with that, I think, is really beneficial. And the number one way to prevent opioid addiction is to never take one. It's really that simple.
I agree. I've worked with addiction for many, many years, that know that when you are taking opiates, that it just doesn't stay at the same rate, obviously. It, your body tolerates it, you want more and more and more. And then many people then do kind of awkward things with their medications. They go to different doctors, and the patterns of addiction gets worse and worse as it shows up. And although your pain is gone, or some matters of your physical bodies, but then you just added, a lifetime illness kind of to yourself from there. You talk about proven ways to treat the pain without the medication. Can you share a little bit about those?
Sure. And so I think, once you're out of that acute flare, then that's when you get into these sorts of treatments. And that's sort of managing it, or if it's a reoccurring pain, if you want to minimize how often it happens. There's a lot of data that shows that the food we eat, so our fuel, makes a difference. So if we eat more inflammatory foods, and the standard American diet, the acronym, unfortunately, is SAD, and that's because it is sad, right? It's hurting us. It's a lot of processed foods. It's not a lot of plants. It's not a lot of vegetables. It's not a lot of legumes. It's not a lot of plant-based proteins. And it's added salt, a lot of trans fat, a lot of saturated fats. And the worst is a lot of sugar, right? So sugar and salt make things live longer on the shelf and still taste fresh. And so all of our food is loaded with that. And that's actually causing more inflammation. And going back to that knee analogy, that's causing swelling in your back and in your muscles. And you can't always see it. So, maybe, someone doesn't have the best eating habits, and they may, because they're not aware that this thing affects their pain. And maybe that was the way they were raised, or maybe a time factor or a financial factor. There's so many reasons. And they're doing something that's actually making their pain more likely to occur and to last longer. And so if we can make these little tweaks that reduce inflammation, again, focusing on food in this discussion, that can make a big difference. And it can be simple, really simple. It has to be goal oriented though. So you can't just say, oh, I want to eat more veggies, right? Because that is not a goal. That is just a general concept. You have to own that goal with a time and a place, how you're going to implement it. So it has to be every night at dinner, half my plate will be filled with green leafy vegetables. Okay, that's a goal. That's something that's achievable and measurable. And that's something you can follow through on. And that's something you should put a little sticker on your calendar, or, in your diary or whatever, even on your phone, that you did it. because the human brain loves rewards, right? So we love that low dopamine hit. And if we can get it from good things, like eating half our plate full of vegetables, as opposed to not so beneficial things such as, donuts and chips, which also give us that dopamine hit, then we're going to end up better in the long run.
And I think the awareness of what type of food affects the body in a particular way, because some people might have allergies to a particular food, which gets them disoriented. There are some food that might do this for everybody, or there are particular food that might match somebody's body and not somebody else's body. For example, I've really noticed when I drink alcohol, like I don't drink alcohol a lot, but once in a while when it's a social, all of my joints start hurting, and then I have shooting pain coming through my body. And a lot of other people don't experience that. Or, I have feta cheese and I feel foggy for a minute. So there are also not only the ones that you said that it's been proven that does this to everybody's body, but this awareness of what happens to my body? What am I not supposed to eat? If I'm going to drink, like for some people, rice is very good. For me particularly, I blow up like a balloon when I eat rice at any time. So that's what happens to my body. So part of the mindfulness that you were talking about is this type of an awareness about your body, that how does your body react to different foods. And it seems like if you're more aware of that, you can start eliminating those or making it less in your diet in that sense, right?
Yeah, I think that's a really great point. Everyone is different. This is completely individual. And keeping a food diary can be a little bit tedious, but it can be helpful, even if you just do it for a couple days. A week would be ideal, and see what are my pain levels those days. Is there any connection? And just sort of keeping a diary, which would be your foods, how much you slept that night, what your stress was on a scale from 0 to 10. And I think when you see it in black and white in writing, that, oh, look, when my stress is this high and when I don't sleep well, my pain is this much worse, it helps you prioritize it. And the same with the foods. If you notice, like you've been very astute to notice, that certain foods aggravate symptoms for you, then you're going to be more mindful and not engage with those foods, and you're going to feel better in general.
You also talked about a very, very important factor, which is the tolerance of pain. I know that, for example, when we even work with emotions, many people utilize different type of numbing agents, let's say alcohol or drugs or anything else, in order to numb their feeling, because they just can't tolerate their feeling. Like somebody has a minute level of anxiety or sadness or anger, they're like, okay, give me something immediately to numb it down because I can't feel, or any type of feeling just becomes so intense. And I'm sensing that where you were talking about pain is almost the same thing, where people have, when they, if there is a chronic pain that is there, that there are ways of learning how to be with that pain versus fighting with that pain. And the more that we allow ourselves to be, and part of the stress reducing techniques that you were also alluding to and talking about, that when you know how to be with the pain, then you kind of like allow it to be and you move on with life, although you take care of it, but move on in life. But it seems like when you are intolerant of it or fight with it or consistently or, in some struggle with it, that it just exasperates it. What are your experience with the concept of containing, as you were sharing with us?
Yes, that's so true. So you may have heard of that acronym RAIN, which is a popular acronym, right? So recognize, allow, investigate, nurture. And that's more for a mindfulness tool for compassion. But in the book, I talk about a tweak on it called pain, of course. And it's to disrupt negative pain, like pain thinking patterns. So sort of thought spirals. And so it's pause and accept are the first two, which is exactly what you're saying is, if you try to fight it, it's just going to make it worse, or it's going to make it come out in another way. So manifest in a different way, whether that's snapping at someone, whether it's having some spasms or pain elsewhere, whether that's your blood sugar or blood pressure rising. So if you struggle with it, or if you try to suppress it, it's going to actually become worse down the road. So after pause and accept, the next part of it's inquire, which is sort of thinking about where is this negative thinking coming? So it's one level to have pain, which unfortunately at some point in our life, we're all going to have some pain. It's another thing to suffer, right? So suffering is the emotional part that comes into it, and that can sort of magnify it. So if you can pause, accept, inquire, why am I thinking this way? Why am I thinking, oh, my pain always does this. Every time I want to do something fun, my back hurts, right? And so you have that thought pattern, built into your mind. And so you can learn to just recognize that and then go to the end of pain, which is now decide what action can I take to make this better? Or maybe there's no action that needs to be taken, but sometimes there is and sometimes there isn't. So you could say, I don't even know if I want to go out to dinner. Every time I try to go out Friday night, my back hurts, right? So I'm just not even going to go. So then you shut down, you lose social connection, and that actually makes inflammation and pain worse too. So another way to go at it is, okay, every time I try to go out Friday, I feel my back pain coming on. How can I be proactive, right? So what shoes can I wear? What non-narcotic medication can I take? Is there a topical patch I can use? Is there a heating pad I can take with me? Can I ask to be seated near the door so I don't have to walk as far? Can I ask so-and-so if I can use their arm when I walk so I have less pressure on my back? So there's lots of workarounds. And I think feeling that you don't have loss of control and that you have some power over it makes it a little bit better. And I'm not going to mislead anyone and say that these techniques mean you have 0 out of 10 pain, right? These techniques mean that the pain is manageable and you can live your life and function. And that's really our goal.
Mhm. So share with us Relief 5R. What is a Relief 5R plan that you have in your book? One chapter is about this.
Yeah, so it's the lifestyle things we talked about. So mnemonics and a system kind of helps make it fit together better. So I came up with the Relief 5R. So the 5 R's are refuel, which refers to food, revitalize, which is exercise, recharge, which is sleep, refresh, which is stress reduction, and relate, which is relationships.
Mhm. And you call it cost-free, quantity, and refill unlimited, no side effect, and evidence-based.
Right, that's my little image with the prescription pad. Yeah, so instead of writing a prescription for a medication, it's the prescription for the Relief 5R plan.
Yes. And then you talk about each one of those in length in how to refuel, what kind of food gives you inflammation and what not to eat, which you were explaining to us. And then you also talk about micro boost and how they help one get to a life with less pain. What are the micro boosts?
So micro boosts are those little steps that add up to big pain relief. So it's doing something small that can make a big difference later. For example, someone who is always seated at their computer for work or for social activities, it's putting a timer on your phone every hour and doing the shoulder shrugs and neck rolls just to loosen up the muscles. You could even do some pelvic tilts. You could pretend to go to the bathroom if you're at work, just get up, take a loop, come right back. The idea is to do tiny little steps which are going to help your overall inflammation level.
And is the inflammation also work with just your body and food and the gut microbe, or is it also would just the stress itself give you inflammation, or is it mostly food related?
You're right. It's really all of them. So they can all cause inflammation. So there's a gut microbiome, which has a huge impact. And that's where you want to eat healthy probiotic food and prebiotic foods. But there's also sleep. So lack of sleep causes a great deal of inflammation. Lack of exercise can cause inflammation, but more than that, exercising can reduce inflammation. And so, we talked about mindset and mood a little bit earlier, and I call like the exercise secret sauce is that it releases painkillers, endorphins. It releases more serotonin, which, as you know, is what's activated in the #1 antidepressants in the United States, or serotonin reuptake medications. So that's a kind of, I hate that term, it's a feel-good chemical, but it is sort of like a feel-good chemical. Exercise activates your natural marijuana, so your endocannabinoids. It actually helps with that too. There's something called myokines, and those get activated too, which help with inflammation of the muscle. So it's all of it. It's not just food, it's exercise, it's stress, it's sleep. They can all help reduce inflammation and make sure you have less pain as much as possible.
And you talk about the pain relieving benefits of polyphenols, the micronutrients that naturally occur in plants.
Sure. Polyphenols are a type of phytonutrient. So phyto means plant. So it's plant nutrient. So it's nutrients you find from plants, and they give plants their color. And so that's why people say eat the rainbow, because they want you to a variety of plant phytonutrients, including polyphenols. And they protect the plant from disease, from insects. And there's something that actually helps reduce inflammation and is an antioxidant benefit for us too as humans. And eating a variety of different colors gives us different types of phytonutrients.
Mhm. Your book has a lot about nutrients and food. As I look at it, not only has about the supplements, it has the concepts of fasting and what works, types of fasting that works. What are your thoughts about the intermittent fasting?
I think there's some good data there for inflammation. I don't know if I necessarily say it's the best thing for weight loss. And I think that's where some of the data gets muddled because people are always looking for weight loss. But it's really great for inflammation. Um, and it has to be cleared by your physician, of course. But the best kind of fasting is intermittent fasting. That's actually circadian fasting or circadian eating. So that's sort of going with the way we were made in terms of natural patterns. So if you eat more matched up to daytime hours and less at nighttime hours, that's better for your overall health. That's better for food processing. That corresponds to your hormone rises and cortisol, melatonin. It's going to help you have better sleep. So, humans aren't made to have a 7-Eleven and a 24-hour open fridge and eat at midnight, and then go to sleep. We need time to process food. We need to not be having those insulin and sugar spikes together so late at night. And we need time to clean up. And so intermittent fasting lets our cells get cleaned up, basically, to get rid of all the debris and to sort of renew for the next day and the next onslaught of food and input.
Mm-hmm. You talked about relief as a cassette for success for the refuel. You talk about removing barriers, intentions, and eating healthier snacks, and the micro boost that we talked about. And then the E is for eye level, like intention, drinking more water, and each night fill up the reusable water bottle and put it in front of the fridge, and then you keep drinking it. Linked to specific activities, eat more plant-based food. I declare to eat more fruit or whatever is good for your body, and then encourage. The E is for encourage progress by tracking, so that you're more aware of what you're doing, and then feel better. You've brought a lot of systematic, and this book is great. It has everything for you, and then it talks about revitalizing, which you shared a bit about. When we're talking about the pain itself, something else that consistently, not only that I'm getting, I'm 60 and I'm beginning to feel it, but mostly as I work with people who are aging, pain just becomes part of life. And it's like, how do you accept it to also be there without it's just, sometimes as when we're young, we don't expect it. And when it's there, we're surprised, as if like, why is it here? Or it's attached to some injury, like, okay, you fall or you're doing sports, and then you expect it to go away immediately. But as you're aging, you don't expect it to go away anymore. You expect it to kind of stay and kind of become best friends with it until for a lifetime. What are your thoughts about that?
Well, unfortunately, yes, as we age, we heal much slower. So, if I get a cut on my finger, it might take a week and a half. And for, my 8-year-old daughter, it takes a day to heal. So yeah, there's definitely different rates of healing. I think what it boils back down to is function, right? So you may have some pain, but as long as it's not keeping you from doing the things you want to do, I think it's a lot easier to accept it. Sort of like you said, in some ways, part of aging for some people. And as long as it's low level. So that's really the goal of the book. That's really the goal of everything I do, is to help people function. So we're not really worried about the pain scale from 0 to 10. We're not going to be hung up on numbers. We're going to be hung up on what are your goals. My goal is to go to my daughter's soccer game. Okay. Is the pain stopping you? Yes. Okay. So we need to work on that. Is it not stopping you? No, I can still go to a soccer game. I can still do what I want. Well, maybe that's just a compromise then, and it's not perfect, but like you said, maybe it's just sort of part of life. And we can always strive to get towards perfect, but at least if you can do what you want, that's really what we're going for.
Another aspect that you also talk about in book, and you talked about it when it's relate, and it seems like when you are with people, with friends, talking, you're in a socialization, a lot of people let go and lift off from their body, and they put themselves out of here and out here. And somehow in that relatedness, togetherness, connectedness, they feel much better versus aloneness and in a lonely time and isolating. And when you're isolating, sometimes your body talks loud. Remember when you're in a house with a lot of wood, when it's all quiet, the wood talks consistently and you're listening to every single sound. But then when you're having a party, when people are there and you're, talking, you don't hear the wood a lot, and the sound of it. And it somehow is almost like the same analogy when people are sitting home doing nothing and kind of like every part of their body, they're more hypersensitive from every single angle that body kind of like squeals and does its own thing. But then when we're together, most people don't even realize they're not suffering from whatever is happening in their body. What are your thoughts?
Yeah, I think that's so true. And I love your, wood floor open house analogy, because that's just so vivid and beautiful, and really easy to relate to. But I mean, we saw it with the pandemic. I mean, again, this is much more your field than my field, but, rates of depression skyrocketed, even within the first few weeks. There's a lot of studies on that. Suicidal thoughts went up as well. We know that one of the harshest forms of punishment, for people who are in prison is to be, put alone, right? Yeah. So they know that that's basically the cruelest thing you can do, right? That's the highest form of punishment, to put someone in isolation. And so that alone sort of speaks volumes. We know it's the worst punishment, so we know it's a gift to be around people. Obviously, there's some people who help you bloom more than others, but there's a lot of data that exactly what you said. If you're by yourself, you kind of amplify things, and you sort of get lost in your own world a little bit. And the other thing that sort of piggybacks on that is having a sense of purpose, that you're helping people and actually helping people. And it can be really little things like holding the door open, smiling at the cashier, really small little things like that. And those tiny little like micro boosts, like micro social interactions can sort of add up to synergistically a much bigger impact. So even if you live alone, but if you go to the library every afternoon, or if you go to the same, coffee shop, and you see some people and you get around and you start to make friends and you say hello and have a little conversation, that's going to make a huge impact on your overall health versus just staying at home by yourself and not interacting with people at all. So yeah, I think there's a lot of truth to that.
So for people who you have worked with where they had injury, they went to an emergency room. Mm-hmm. They got prescribed pain medication. I went to because I had a bloody nose and I came out with 30 Vicodins. I have no idea why.
Wow.
And so a lot of people, when they go into the hospital for any reason, they are prescribed some sort of a pain medication. They get involved. Now they have the issue. But then when they want to quit or they want to go into rehab and they want to let it go, the fear of I cannot tolerate pain keeps coming back up. And sometimes we see this revolving door. And I'm talking beyond just the matter of the addiction itself, that there's really some pain there that, is valid. The fear of not having the ability to tolerate pain is there. What are some of your suggestions that you have for your patients as they might come in to you while they're already using opiates and you're trying to work with them with the pain management techniques so that they can get off of the opiates and then move to other solutions that are beyond opiate, but tolerant of pain?
So I think, one thing is working with a great therapist, and having part of a multimodal team approach to it. So, me again, sitting for 15 minutes with a patient isn't going to solve, an issue like that. So I think having a great support system, I think having little tiny goals, and again, functional goals. So for someone like that, they're so worried about the pain that talking about pain numbers on the 0 to 10 scale is pretty much useless. So you have to say, okay, where our goal is, if you are going to be weaning from a medication with, again, a whole team and just going down by half a pill, of something today, can you still walk to the mailbox? Can you still get this done? And no one's trying to say it's pain-free, but can you still do this? And I think when people see little bits of achievement and recognize their own power, then they do better. And thankfully, actually, where I practice, I work with people who mostly aren't on narcotics and are trying to avoid narcotics. And that's why they come to me, is because they have pain, or they had a back or knee surgery and they never want to go through that again. So they sort of want to be proactive and prevent further degeneration and inflammation. And so, I'm lucky I get to see a lot of motivated people like that.
Beautiful. Are there also medications that are not narcotic, but they're also localized? Like they would actually give, for example, if your knee aches, that it goes specifically to the knee, and have the medication localized versus your whole system having to digest it and go through your whole system?
Yeah, I mean, what comes to mind for that would be topical treatments, so creams and patches, especially. There's a lot of over-counter patches that people can have access to, and if it's okay with their physicians, it could be like a Novocaine or lidocaine patch. It could be Voltaren gel, which is like ground up Advil in a gel that you could rub into an achy joint. There's also something called a TENS unit, which is like little electrodes that pulse the muscle. So there's a lot of localized treatments. There's heat, of course, and ice. I'm also an acupuncturist. So there's acupuncture, which is, whole body, but can also zoom in on a painful area as well. So I think there's a lot of non-medication treatments that could be helpful for people.
How does acupuncture support the pain relief?
So it depends on which philosophy you're talking about. So Eastern philosophy talks about chi and energy movement. Western philosophy in terms of orthopedic pain, and there are NIH backing actually of acupuncture for joint and spine pain especially, talks about more like trigger points and local spasms and treating local areas of inflammation. So it sort of depends on your perspective, but there's definitely a role for it. And a lot more of insurances are even covering it these days too.
Well, I've used acupuncture also for allergies. It was interesting because I went through this time that it was a lot of rashes, and amazingly enough, I went through the whole Western world of how to handle allergies and couldn't find anything or couldn't do anything about it. And then acupuncture actually treated my allergies, which was really, really amazing to me. Another piece is important after COVID, and I don't know if our listeners or viewers have had this experience or not. I have had a lot of clients who, after getting COVID, they had a huge amount of panic attacks, tremendous amount of depression, people who were not depressed at all before. They were high functioning people who were working long hours, and they had amazing social life, and all aspects of their life was beautiful. And then after having the COVID, and after 3 to 4 weeks, they had a tremendous amount of anxiety, panic attacks, consistently, the body being activated. And I sent them to acupuncturists after a while, and it was amazing how that kind of balanced their system again, and the panic attacks went away.
Oh, wow. That's really interesting. Yeah, that's fascinating. I mean, Chinese medicine talks about qi and energy movements. And a lot of Ayurveda medicine talks about energy movements as well. So a lot of ancient systems talk about that, and they've been around for 3,000 years. So there's probably something to that. But Western medicine has done functional MRIs. That's where they take MRIs of someone's brain, and they're actually watching live as they light up, and they find that the pain controlling pathways and even some of the inflammatory pathways, which can contribute to mood disorders as well, light up with acupuncture. So there is something to that, but that's really neat that you can offer that to your audience, because if a lot of people are going through that, they may not naturally put together acupuncture as a treatment.
Yes, because it's not necessarily a psychological issue, although because it is an anxiety and depression, obviously they come to me. But as I work and teach them a lot of the factors, it's just their body's system got shocked into thinking that they're in danger. And no matter how long we're constantly bringing their calming down with their thought processes, bringing it down. And yes, we'll bring it down, but why not? Like, if you balance the system, the meridian system, we get there much faster. Why not to have the psychotherapy plus acupuncture together? So one, balances the system, while the other one would shift the thought and remind the body that, yes, you're not in danger anymore and you're fine and everything is okay.
Yeah, I think that's great. I think that really emphasizing that it's not one or the other, right? So it's always both, because you always want to not put all your eggs in one basket, right? And attack something from a few different angles, because that's going to give you the best chance at the best response. And so I think that's neat the way you said that, really doing both. I've seen a lot of people after the vaccine, even, and also after COVID, that if they had an old arthritic shoulder or knee, it becomes suddenly inflamed and angry. So these old musculoskeletal injuries, which are kind of like calm or low level, suddenly are angry. And that's because it activates your immune system, your inflammation system. So it causes more inflammation. That's part of the vaccine's job. And that's part of what happens with COVID. You get inflamed. There's even a pediatric inflammatory syndrome. There's a name for it. So I think, really doing things that reduce inflammation can really help in your general health. I mean, my book talks specifically about back and muscle joint pain, but honestly, it's for overall health, right? So doing these things is going to help your mood. It's going to help diabetes. It's going to help high blood pressure. It's going to help all these inflammatory conditions. And it's going to help you live better, and sort of be your best self in a lot of ways.
Dr. Saloni, Sharma, everyone, the book is The Pain Solution, 5 Steps. Relieve and prevent back pain, muscle pain, and joint pain without medication. This book has so much to offer. It has details of what to eat and what works, and the exercises and how to rejuvenate. And it's a full-on book about how to support you be healthy. In 1 minute, as we're coming to a close, Saloni, anything we haven't shared that you really, really want everybody to know?
Yeah, thank you. And thank you for this beautiful talk. It was lovely discussing things with you. I think that some of these things sound simple and may have sound like, oh yeah, of course, if I sleep better, eat better, then, I'm going to feel better. And that's the truth. The answer and what the book shares, though, is the science behind it. So the evidence of how it works and the how, right? So it's the why and the how, and that's what we're often lacking. If you see a knee surgeon and you're over a certain weight, they'll say, lose weight, come back to me. Then I can talk to you about a knee surgery. I'm not doing it if your BMI is too high. And that's kind of the end of the conversation. And that really leaves someone hanging. So this book is really the how, with these little micro boosts, how to make these tiny changes that don't break the bank, that don't require hours of time. And that's really, what we're trying to help with here.
Beautiful. Thank you so much for taking the time and being with us.
Thank you so much for having me. I love your show. I really enjoy it.
Thank you. So everyone, go get the book, The Pain Solution, 5 Steps Without Medication. And for all of you who are out there, create an amazing life for yourself and everyone around you. And until next week, bye-bye.